Hello, my name is Iman, and I am a 30-year-old doctor working in a busy hospital. Being a doctor is not just a profession for me, it's my passion, my dream, and my calling. It's a path I chose when I was very young, and every day I am thankful that I have the privilege of helping people through their most difficult times. In this story, I will share the details of my journey to becoming a doctor, the challenges I face every day, and the rewarding moments that make it all worthwhile. From early mornings to late nights, my days are long and filled with hard work. But the impact I have on my patients' lives is what keeps me going. Becoming a doctor wasn't easy, and it didn't happen overnight. After high school, I spent several years in medical school learning about the human body, diseases, and treatments. I remember the long hours spent studying anatomy, biology, and pharmacology. It was exhausting, and there were times when I thought about giving up, but I always remembered why I started: to help people and make a difference. One of the most challenging parts of medical school was the clinical rotations. During these rotations, we had to spend time in real hospitals, working alongside experienced doctors and treating real patients. I was both nervous and excited to step into the hospital for the first time. My heart raced when I saw my first patient, and I felt overwhelmed by the responsibility. But with time, I grew more confident, learning from each experience and building my skills. After medical school, I entered an internship program where I gained hands-on experience in different specialties. I remember my first surgery vividly. It was a simple procedure, but I was so nervous. The surgeon guided me through the steps, and I learned the importance of precision and focus in every action. That moment made me realize that being a doctor isn't just about knowledge, it's about having the courage to apply what you know in real-world situations. Now that I have been practicing for 5 years, my days follow a pretty consistent routine. My mornings start at 6 a.m. every day, and I try to follow the same routine to help me start my day with energy and focus. I wake up, drink a glass of water, and take a quick shower. My breakfast is always light and healthy, usually eggs, some toast, and a cup of green tea. I need to have a clear mind and energy to face the busy day ahead. At around 7 a.m., I leave my house and drive to the hospital. I always make sure to arrive early because being on time is critical in medicine. The hospital is a large, bustling place, and it can get overwhelming, especially in the mornings when many patients need attention. When I arrive, I check in with the nursing team and review my schedule for the day. I quickly go over the patients I will be seeing, their conditions, and any urgent cases. I also check on the patients I saw the day before to make sure they are doing well. By 8 a.m., I start my rounds. I visit my patients, one by one, and check their condition. I listen to their concerns and try to make them feel comfortable. Being a doctor is not just about diagnosing illnesses, it's also about building trust with patients. I make sure to communicate clearly, answer their questions, and explain their treatment plans. There was one patient who really left an impact on me. A young woman had been admitted to the hospital for surgery, and I was her primary doctor. She was extremely anxious and afraid of the procedure. I sat with her for over an hour, explaining everything in detail and assuring her that everything would be fine. That extra time spent listening to her fears made all the difference. She later told me that she felt much calmer and more confident because of our conversation. Throughout the morning, I may also perform some minor procedures, like taking blood samples, performing physical exams, or dressing wounds. Every small task matters because it contributes to the overall care and comfort of the patient. By noon, my schedule gets busier with outpatient consultations. At the clinic, I meet a variety of patients, some with chronic conditions like diabetes or hypertension, others with more urgent issues like infections or injuries. Each patient presents a unique case, and my job is to quickly assess the situation, diagnose the problem, and determine the best course of treatment. One of the most interesting cases I worked on recently was a woman in her 40s who came in with complaints of dizziness. After running several tests, I discovered that she had a vitamin deficiency that was affecting her balance. I was able to recommend dietary changes and supplements, and she returned to her normal routine shortly after. It was one of those moments that reminded me of how vital it is to consider all possible causes when diagnosing a patient. Lunch is a short break, and I usually eat with my colleagues in the hospital cafeteria. We talk about difficult cases, share tips on patient care, and laugh about the more unusual situations we've encountered. Even though our work is serious, we try to keep the atmosphere light because laughter helps us manage the stress. In the afternoon, I often perform more complex procedures. Whether it's stitching a wound, draining an abscess, or setting a broken bone, I have to stay focused and calm. One of the most difficult things about being a doctor is handling emergencies with composure. It can be stressful, but I've learned to stay grounded by taking a few deep breaths and thinking through the steps carefully. A memorable moment from my career happened one afternoon when a young man was rushed into the emergency room after a car accident. He was unconscious, and his injuries were serious. My team and I worked quickly to stabilize him, running tests and giving him the necessary treatments. Thankfully, he survived the ordeal and later came to visit me in the hospital to thank me. He told me that he wouldn't have made it without the care he received, and that's a moment I will never forget. By the time evening comes around, I'm usually exhausted, but the work isn't over. I spend time writing reports and updating patient records. It's essential to document everything accurately so that other doctors and nurses can follow the treatment plan. Sometimes, I find myself working late into the night, but it's part of the job. Sometimes, I am also on call. This means that if a patient needs urgent attention, I must be ready to return to the hospital. I've had many nights where I've been called in for emergencies, but over time, I've learned how to balance the demands of the job with my personal life. Despite the long hours and the pressure, I love being a doctor. The most rewarding part of the job is knowing that I've made a positive impact on someone's life. I remember a patient who came to see me for a routine checkup. She was nervous about her health, but after I reassured her and helped her understand her situation, she left the clinic smiling. That moment made me realize that sometimes, the best medicine is simply providing comfort and understanding. Another reason I love being a doctor is the continuous learning. Medicine is a field that is always changing, and there's always something new to learn. Whether it's attending conferences, reading research papers, or learning new techniques, I am always striving to improve my skills and knowledge. Through all the highs and lows, I've learned that being a doctor requires empathy, resilience, and a deep passion for helping others. It's a job that tests your limits but also rewards you with moments of pure joy when you can make a real difference in someone's life. Although the hours are long and the work is demanding, there is no greater feeling than knowing that you've done your best for your patients. Being a doctor is not just a career, it's a way of life. It teaches you patience, humility, and the importance of staying calm under pressure. And most importantly, it reminds you every day that you are part of something much bigger than yourself. We are all in this together, and that's what keeps me coming back every day. Thank you for listening to my story about my job as a doctor. Every day brings new challenges, but I wouldn't have it any other way. If you're thinking about becoming a doctor, I encourage you to follow your passion, stay dedicated, and remember that helping others is the most rewarding part of the job. What's your dream job? Let me know in the comments.